The next savings would be the administrative cost of the insurance company. What are they charging you to administer the plan? That goes away. And then last but not least, that extremely evil portion of the plan, the insurance company profit. That goes away. So in all, you're looking at a self-funded plan that could save you 10 to 15, maybe even more % in overall cost of health insurance. So these can make sense. And how do you find that out? You get an independent broker that understands self-funded, and he collects a certain amount of data, basically claims information, and you turn that in to a TPA, a third-party administrator, and they go shop the market. And they come back and tell you, here's what's going to cost you for your stop loss, here's what's going to cost you for your aggregate, and here's your exposure out of pocket, the total amount of money you could spend in a year. If you add all that up, and it's less than what you're paying, that might be a really good deal. Some other things that happen here on self-funded, you design your own plan. So you decide what the prescription drug coverage is going to be. You decide if you're going to pay for emergency room or have people go to urgent care, because urgent care is a more cost-effective way of buying health care. So now the emergency room is subject to the deductible, but the urgent care is $20. What do you think they're going to do? They're going to go to the urgent care. It's called behavior modification. That's what they're going to do. So you have a lot more control on the self-funded plan. One of the other things that's really great about self-funded plans, I don't know how many of you saw this a number of months ago when the debate was raging over the healthcare reform issue, but there was a big editorial in the Wall Street Journal by the president and CEO of Safeway. And he talked about how he'd held costs down to 3% increase in his plans over the years. And he did it on a self-funded plan by forcing people to do a health risk assessment form and then targeting that 20% that were driving the claims. There's a company here in Kansas City, Deffenbaugh Disposal, and the lady that runs the human resources department, his name is Carrie Andes, and she's brilliant when it comes to self-funded. She put a mandatory health risk assessment form, and you can do that with self-funded. It can be mandatory. All of her trash truck drivers had to fill out a health risk assessment form. She was able to drive her costs down 16% by doing that. 16%. Just by identifying what the problems were. And she had drivers come up to her months later and thank her for what she did, because they didn't know they were pre-diabetic. They didn't know they were at risk for heart attack because they smoked, but they didn't link, not me, it's not going to happen to me. Yeah, it is. And so she was able to identify that. Health risk assessment forms are completely confidential. They don't go to the employer. They don't go to they go to the insurance company or the TPA, who then identifies what the problem is, and maybe you have a wellness management company that oversees that and comes in. Some people even bring in a phlebotomist and do blood draws right there on the work site, so they can identify cholesterol issues, other kinds of issues. This all goes back to the same thing: unit cost and utilization, controlling the cost of health care. Self-funded plans allow you to be a little more aggressive with that, and you can make some great headway in making that happen. So these plans can make a lot of sense, and they're not just for big companies. Like I said, I've seen companies of 50 employees that do them and do them very well. So there are opportunities here that can make a big difference in your cost. And as we get closer to 2014, these plans are going to become more attractive.